Now, the government has insisted throughout the coronavirus crisis that it's been guided by the science. We've seen the experts standing alongside the Prime Minister at those daily press conferences, of course, too. And Sir Mark Walport was the government's chief scientific advisor for 4.5 years. He joins us now from West London. Thank you very much for being on the programme this morning. Now, I know that you've been really following and involved in the development of that vaccine for COVID-19. When, realistically, do you think a vaccine could be ready?
Well, I'd like to start by picking up the point that Tony Blair has just made, which in fact is that there is enormous international scientific co-working on this. And so CEPI, which is the Coalition for Epidemic Preparedness Innovation, which the UK has just committed £210 million to, has been working across the world on vaccine development. They have 8 in their active pipeline at the moment, one of which is one that UK Research and Innovation and others have been funding in Oxford. And so there is an enormous amount going on. And he's absolutely right also that science and technology and innovation is critical to both providing the advice and the management. As I told you when I appeared recently, the reality is that we need to be sure that a vaccine is effective and doesn't have side effects or serious side effects. And so it will take probably a year to 18 months. Everyone will work extremely hard to make it as quick as they possibly can. The regulators are working much faster than they do normally. And so everyone will do absolutely everything they can to get it to people as quickly as possible. And indeed, the scale up of that particular Oxford vaccine, although, whether it stands a better chance than any of the others, who knows, we'll be able to manufacture up to 1 million doses fairly quickly. But, of course, that's a long way from protecting the whole population. And as I say, the other thing we need to understand is more about the protective immune response to coronavirus.
Tony Blair was also saying that he thinks the most likely way out of the lockdown, if you like, is actually through mass testing. Nearly everyone, he said, could be tested, and then to find out more, as you say, about that immune response. Do you think that that perhaps is the most realistic way out of the situation we're in now?
Well, I mean, the science advice is actually absolutely rock solid worldwide that the best way out of this is to keep people apart from each other, which is why the advice of stay at home is so critically important. In other words, the one thing we know is that you need to reduce the number of people that one infected person infects on average, which is about 3 for this virus, we think, down to below 1. And the only way you do that is by separating people. Now, it is also absolutely the case that we need to be able to test people who are working in the front line for whether they have virus infection. And if we're really going to understand and be able to model the epidemic properly, we need to know what fraction of the population has been infected. And so really there are 2 types of tests. There's the test for the virus, and then there's the tests for whether people have been infected and have, as has been said already on the programme, what should be a protective immune response for at least months, if not a small number of years.
Just to pick up on that point, an Oxford University study this week suggested that up to half of us could actually have been infected with coronavirus. Do you think that's at all realistic?
That paper has been, firstly, it hasn't actually been peer-reviewed by other scientists, and secondly, it has been pretty uniformly criticised for the assumptions it's make in the modelling. Firstly, it assumed that there were a limited number of vulnerable people who would succumb, and the evidence is that although they are the most vulnerable, we also know that some people die of this for reasons we don't yet fully understand in terms of their susceptibility. And secondly, the model basically put in the fact that there may be large numbers of uninfected people. The evidence, such as we have it emerging from Italy, example, is that unfortunately there probably aren't an enormous number of people who've been infected but completely asymptomatic.
OK. Now, you were saying there that the evidence shows that social distancing, keeping apart from each other, is the single most important thing that we can do. But of course, that pays a heavy price we pay for that, for keeping away from our loved ones. It's a difficult thing for many people to do, particularly, of course, if you're in a small apartment or something like that as well. Now, I just wonder if you have any steer on how long you think that the lockdown could go on for, because if that's the most effective thing we can do, and the vaccine is not going to be ready for at least probably a year, it feels as if this could go on for many months yet.
Yes, and that is why the best advice is coming from the modelling community and Neil Ferguson himself, who's leading the team at Imperial. But it's also important to mention we're not dependent on a single team of modellers. There are modellers at the London School of Hygiene and Tropical Medicine. There are other modellers. So they're working with each other. And I can tell you they're not suffering from groupthink, because these are a very feisty lot of researchers who, will argue right down to the last details. But what Neil Ferguson is saying is until at least the end of May and possibly June. But of course, that's the operational challenge, because as you say, there's the balance between keeping society going as normally as it possibly can, making sure that all the supply lines work, minimizing that disruption, which of course has potential for adverse mental health consequences that we know about from isolation. So it's always that balance between clamping down on the disease spread, whilst at the same time keeping society going as normally as we possibly can in an extraordinary abnormal time. And that's why this real-time modelling, this real-time input into the politicians who are leading the response by researchers on the Scientific Advice Group in Emergency, reporting to Patrick Vallance and to Chris Whitty, that's an embedded mechanism that we have in the UK, and I think it is really amongst the very best in the world.
Do you think we could see a situation where we effectively alternate between periods of stricter lockdown, relaxing things slightly, and then tightening up a bit more?
Well, so I think that is a possibility. And of course, everyone's looking very carefully at China and Korea. China was obviously, sadly, ahead of everyone else in this in terms of the timing of the epidemic. The disease emerged in Wuhan. And they've clamped down very hard. And I think everyone around the world who understands the epidemiology is looking to see whether the outbreak does start again, because there's no doubt that cases will have gone right across the whole of China. So there may be very low levels of infection. And again, it's that balance between stop, start, and trying to smooth out the epidemic. But I mean, also, I think in the next phase, it will be really important at a time when we have much better and more abundant testing to do that testing whenever an outbreak seems to flare up again. And countries around the world are tooling themselves up to be able to do that.
OK, thank you very much for being on the programme. Thank you very much.
Thank you.